When the words chronic conditions are mentioned, most people assume that a doctor or hospital is their only source of professional help. However, this is definitely not the case. So tell me, Matthew, how can a pharmacist help manage chronic conditions?
Well, a pharmacist and a pharmacy in general, I guess, can help with chronic conditions by starting with medicine. As we've discussed before, a pharmacist studies basically 4 years about medicine. So I guess we're the expert on medication. So we can start with that. So we can make sure we can review the medications that you're currently taking, because making sure that you're taking the right medication, the right dose at the right time, and minimising interactions and side effects for you, hopefully will enable you to take that medicine and get the effect of that medicine that's expected by your doctor and your specialist and so forth. So I guess that's where we can really start. If we can get a good gauge of what medication you're taking and make sure that's working well for you, and that you're taking it at the right time and the right dose, that's going to help improve your chronic conditions such as pain and diabetes and weight loss even, and heart disease and a whole bunch of other things, asthma and so forth.
There's so many chronic diseases.
Yeah, there's a whole lot, and it's important that, I guess, we start with the medication. That's probably the biggest thing with pharmacy.
Because I know, like, doctors know medication, but they mostly are there to diagnose issues, not really, like, they know enough about medication, but that's really what a pharmacist specialist is.
Yeah, doctors are there to diagnose and prescribe predominantly, a GP, that's what they do. And that's their specialty. Our specialty then is to make sure that we're advising on what your medication does, how it works, what might interact with those medicines, so you're getting the best result out of those medicines. How to take those medicines is also an important thing. Should you take these medicines with food or without food? How do you use an inhaler, for example, if you've got issues with asthma, and a whole range of things. So we can provide a lot of advice around getting the best out of your medication. There's also other things that we can do as well, like look at what your DNA and your genetics suggest about what medications are going to work better for you over other medications.
Yeah, that's really interesting. So that's a DNA test that you can do.
Yeah, a simple DNA swab, and that gives yourself as well as your prescriber a really good indication on a number of different medications that are commonly used and how they might interact with you. Some medications, by virtue of how your genetics are made, will metabolise differently. Some may metabolise as they would normally be expected to, others might metabolise quicker or slower. And that will affect dose, it will affect, is that medication best for you to take, or is another alternative better for you to use? So that gives yourself and your GP a really good understanding of how medicines will work specifically in your body, and we can help with that sort of stuff as well.
That's awesome. So if you just got diagnosed with a chronic condition, you could come in, get that MyDNA test, and then find out, like, for instance, I might have, I don't know, mental health issues or something like that. You can find out what medication would be better.
Exactly. In that instance, which antidepressant might be more effective for you, that would create less side effects and have a better result. So we can help, work through with yourself and your GP, for example, on what would work best in that instance. Pain relief is another one. Cholesterol and heart medicines are others. Stomach issues, all that type of stuff. We can help with those kinds of things. So.
That's awesome, because I think one of the things when you do find out you've got a chronic condition is that medical journey, like that first medicine journey. You get that adverse reaction, and you've got to go back to your doctor. They've got to prescribe something else, and you've got to try a different medicine. Whereas this simple test can really help.
That's right. It can be very daunting, and particularly for taking more than one medicine for a specific condition or conditions, it can become difficult to manage. And that's another area where pharmacy can work in really well to assist by packaging those medications into daily dosage units, so that you can take those medicines with you if you're on the go. You don't forget your morning or afternoon dose just because you're out playing golf or babysitting the grandkids or whatever it might be. So we can assist with that to make sure you're taking the right medicine at the right time.
And package it all together. I like it. So it's a simple daily dose.
Very simple.
Yeah, I love it. So do you have any other products or services that can help people who suffer from chronic conditions?
Yeah, others are, some of our stores have a team of naturopaths as well that work closely with us and our pharmacists. So we can support you if you're looking for alternatives when it comes to handling chronic disease, or just or supplements and how they might interact with your medication. We've got the expertise both from the pharmacist perspective and a naturopath perspective. So we can support you in that way as well if that's an area of interest for you too. And we have some other specialties as well within our business that enable you to look at other ways of managing health. So that might be we've got a specialist service at one of our Townsville stores that looks at compression stockings, for example, and how that will help you with circulation, preventing issues like pressure wounds and ulcers and stuff like that as well. So
you've got a diabetes.
We've got a diabetes educator, Chris, that works within our Warri store as well, so he can help liaise with your GP and yourself as to how to educate you best on your diabetes condition and branch out into things like weight loss and medication reviews and that type of stuff as well.
And you also do compounding as well.
Yeah, compounding is another one, and that can be used for chronic conditions. It can help all the way through children right through to more senior people, as well as your own pets as well. So we can compound medicines, a whole range of different medications in different types of dosage forms, like capsules, creams, ointments, trochets, which are little lozenge that you can put under your tongue.
And that's like specialty made
special doses, flavours, dosage forms, as I mentioned, specifically for yourself.
Tailored medicine.
Yeah.
I love it.
Yeah.
Now, my last question for you today is, why is it important then for people with chronic disease to stick with one pharmacy? Because often we stick with one doctor, but many of us think, having one pharmacy doesn't really matter, I'll just go to the closest one.
Yeah. But
why should people stick, especially with chronic conditions, stay with one pharmacy?
It's important for a few reasons. One, we get a really good understanding of what medication you are currently taking or have taken in the past. That puts together a picture for us on how to help you best, particularly when it comes to interactions, how to take certain medicines or combinations of medicines. It also enables us to package, like I mentioned before, pack those medications in the dosage units, so that makes it easy for you to remember what to take and when to take. From a My DNA perspective, like your own DNA, we can put together a better picture then on what medication would work better than others, particularly if you're changing medicines or being prescribed something new. So it gives us access to all of those things as well. So from a pharmacist's perspective, the more information we've got, the better it is to help.
Yeah, and I think script emergencies happen a lot too.
Yeah, exactly.
I know my husband's a diabetic, and we've had many a times where it's like, oh no, the script's expired, or or he can't find the script. Yeah. Whereas, I think the beautiful thing with Calanna is we've been able to call the pharmacy, and you guys have been able to help out, or we've been able to use the MedAdvisor app, and he's got his script filed there, which is really helpful. You can just do it all through the app, and you guys even deliver his medicines for him as well.
Yeah, our app platform does that really well. In a simple way, and I guess the other thing that you touched on is being able to help out in those emergencies where you may not have a script or
it's so stressful,
whatever. And there's a couple of different options that we've got now that pharmacy have now to be able to continue to help you supply with those medicines, but it makes it easier for us to do that if we've already got your full medication history.
So there you go. Having a positive relationship with your pharmacist is very important at the best of times, but especially so if you suffer from a chronic condition. Calanna offers so many great products and services, along with genuine understanding and a care factor to help those diagnosed with a chronic condition, because you've already got enough to worry about. So contact the team at Calanna today to find out exactly how they can help your family through living with a chronic condition.